വെൽക്കം ടു മൈ ഹോസ്പിറ്റൽ. നമ്മൾ സ്ത്രീകളെ പലപ്പോഴും അലട്ടുന്ന ഒരു വിഷയമാണ് ബ്രസ്റ്റ് ക്യാൻസർ അല്ലേ? ബ്രസ്റ്റ് ക്യാൻസർ ഏതൊക്കെ ടൈപ്സ് ഉണ്ട്, ഇതിനെങ്ങനെ ഡയഗ്നോസ് ചെയ്യാം, സംസാരിക്കുന്നു ഡോക്ടർ സഞ്ജയ് തുരുത്തേൽ, കൺസൾട്ടന്റ് ഓങ്കോളജിസ്റ്റ്, ശ്രീ സുധീന്ദ്ര മെഡിക്കൽ മിഷൻ ഹോസ്പിറ്റൽ, കച്ചേരിപ്പടി.
Today I'm going to talk about the breast cancer. Recently, over the last few years, there's a lot of discussion regarding breast cancer, as we are seeing a lot of increased number of breast cancers in the last few years. Plus, the people suffering from breast cancer also are having a decreasing age. So, in India, 2022, there were 14 lakhs cases of cancers in 2022, of which around 2 lakhs was breast cancer. So, it says that the breast cancer is the most common cancers in India actually now. If you talk about cancer, who can get a breast cancer? Actually, females get the breast cancer, but all males also can get a breast cancer. Regarding the risk factor for breast cancers are like being a female itself is a risk factor. Age is a risk factor. Getting older increases the risk of breast cancer. The third risk, something called family history. If female has a risk, if family history of breast cancer, then she has increased risk of breast cancer. Then there's something called genetic syndromes are there, which can cause the increased risk of breast cancer. Modern lifestyle, obesity, alcohol intake, smoking itself, all are risk factors for the cancers. So these are the main risk factors for cancer. Now, what are the early symptoms of breast cancer? The commonest symptoms of breast cancer is feeling like a lump in the breast, or something like a pain in the breast, sometimes like discharge from the nipple, or some changing of the skin color of the breast. These are the commonest symptoms of breast cancer. So, if you have some symptoms related to breast cancer, what should be done? The first thing is to consult a doctor, and mostly doctor will be doing a ultrasound of breast followed with a mammogram. If there is something suspicious regarding breast cancer, then a biopsy is done to confirm there is a breast cancer. There are 3 different types of breast cancer. One is the breast cancer which is mostly what we call is hormone dependent breast cancer. See, this is most common is the hormone dependent breast cancer. Around 60% of breast cancer are called hormone dependent. This type of breast cancers are mostly treated with surgery and hormonal therapy. Then there is 20% of breast cancer is dependent on a protein called HER2 protein, which is more of an aggressive cancer. And then there is a third type of breast cancer which we call is triple negative breast cancer. Now this triple negative breast cancer is very aggressive, and we see it more in younger age. Like the common age of breast cancer is around 60 years, but the triple negative breast cancer comes in the age of 40 to 50 years. Treatment of breast cancer is mostly surgery. But after surgery or before surgery, there will be some sort of treatment which can be chemotherapy, hormonal therapy, or some targeted therapy. So it's basically treated with a combination of surgery, radiation, and chemotherapy and hormone therapy. Breast cancer is curable if diagnosed at the early stage. Like in Western countries, around 70% of breast cancer is diagnosed in stage 1 and 2. So if the breast cancer is diagnosed in stage 1 and 2, maybe 95% of them are cured actually. But if the breast cancer is diagnosed in stage 3 and 4, then the chance of cure becomes less than 50%. So it's very critical that the cancer be diagnosed at the early stage so that the chance of cures are much higher.